1% of people lose all their excess weight. And of those, almost everybody gains it back. It's the brain that's blocking us from losing weight.
The only thing that statin drugs do is they lower your cholesterol. And you have to get away from the thought, which is invalid, that that's a good thing.
When you use abstinence as your only tool to deal with sugar cravings, the second you reintroduce it back in, you are right back to where you started. And it's because you have not corrected the reason you're craving it in the first place.
Who should consider that maybe they have a gluten sensitivity? Anyone who is sick. If you are tired, that's being sick. You might have a gluten sensitivity.
Bioidentical hormone replacement is fine for relief kit if you just need some quick relief, but it's not addressing what's really wrong.
Everybody I've seen who was on a drug and went off the drug, because you have to go off them after 5 years or so because it's too dangerous to continue, they lost more bone than they gained. They ended up worse than they started.
The research clearly shows that while the anti-arthritic drugs are greatly reducing your pain, the use of them is accelerating the progression of your arthritis.
Menopause and the symptoms of Hashimoto's are pretty much the same. So we don't want to guess. We always want to test to see what we're dealing with.
The problem is not that you're too busy. The problem is not that you're overwhelmed. The problem is that you continue to talk about the overwhelm and the busyness.
If you have infections, whether they be fungal or parasitic or bacterial, you can be waking up and having bad night's sleep.
To be constipated as a matter of course is not normal, and it's really not healthy at all.
Magnesium deficiency will cause your blood pressure to become elevated.
You are made up of energy. And when your energy is out of balance, there are problems.
Hot flashes, night sweats, mood swings comes from the stress response. And so if you have a way to nip your stress response in the bud, you can prevent a lot of the problems that would happen associated with perimenopause.
Challenges are bound to happen in our lives.
Right.
You know, we are going to have stress. And those are gifts. It's allowing you to look at what's going on and how you're responding and how you can shift things and move in a different direction.
All those common kitchen herbs and spices, like your sage, thyme, rosemary, ginger, they are all highly, highly, highly antibacterial and antiviral.
If you have a mood disorder, so if you have depression, anxiety, insomnia, or even more serious things like schizophrenia or bipolar disease, very frequently we can find triggers in the gut that can be reversed.
The top 3 killers, heart disease, diabetes, and cancer, all can be caused by insulin resistance.
Headaches, the joint pain, rash, nasal mucus. This is attributed more so to leaky guts.
The worst thing is to cut down on your fat after age 50. We need it for our skin, so it doesn't start to sag and have a bunch of wrinkles. Fat is where it's at.
It's really strength training long term is really going to change your metabolism the most and change the way you look in your jeans.
If you've got to the point where you have pain in your hips, you've got pain in your knee joints, you've got pain in your ankles, you've got herniations, subluxations, then you've been a long time ignoring what's been going on mentally, emotionally.
Women over 50 are taking upwards of 5 different pharmaceuticals. The problem with these drugs taking long term is that they are depleting us of life-sustaining nutrients, which then can cause us a whole host of other diseases, deficiencies, and imbalances that we have no idea are related to the drug that we're taking because they don't show up right away.